So maybe a first question would be, give us a state of just your tribes. Madison has just been designated in December, Truax Field, as the home of F35A. Doctor, can you start? Give us an overview. December 15th is the deadline for Wisconsin residents to sign up for health care under the Affordable Care Act. This year, 205,000 Wisconsin residents enrolled in the ACA. So that emerging deadline and the importance of the ACA to Wisconsin healthcare is why I want to thank Andrea Palm, Secretary of the Wisconsin Department of Health Services, and Donna Friedsam, Health Policy Programs Director for the UW-Madison Institute for Research on Poverty, to talk to me about the ACA in Wisconsin. Thanks very much.
Thanks for having us.
Really appreciate it.
Here.
10,000-foot question. How important is the ACA to Wisconsin's healthcare?
So I think fundamentally the Affordable Care Act was designed to build on and expand access to coverage for folks all across this country. So, most people still get their health insurance from their employer.
Right.
We've got Medicare for those over 65. We've got Medicaid Badger Care for particular eligibility categories, lower income folks. And then the Affordable Care Act was an opportunity for folks to have access to high quality plans that protected them from things like pre-existing conditions, out-of-pocket limits, things like that, so that they could have access for the first time to affordable health care. And as you said, over 200,000 folks in Wisconsin rely on the Affordable Care Act marketplace to have access to insurance that they can rely on. And so we're here today because the deadline, as you said, is December 15th, and we really want to encourage folks to take a look at healthcare.gov, at the plans that are available to them, use navigators to help them navigate the process and pick a plan that works for them.
So Wisconsin residents are healthier because of the ACA?
I think the nation is healthier because of the ACA.
Okay.
Yeah, we've insured 20 million folks since the enactment of the Affordable Care Act because of the Affordable
You say
Care
that as a former member of the Obama administration.
I do.
Okay.
I just want to note that the 205,000 people is very important, but the ACA also provides protections to basically everybody in the state that has insurance, because all of us, you and presumably you with your health insurance, certainly I with mine, and anybody with employer-sponsored insurance has the benefit of the ACA because of the restrictions now in lifetime and annual limits, no pre-existing condition restrictions and the like. And while some of that existed at the state level, that for the most part cannot be regulated at the state level for self-insured employers, and half of our state is self-insured.
Wisconsin traditionally has been number 2 behind Massachusetts in the number of residents with health care. Are we still over 90%? Do you know, Secretary?
Yeah, I mean, we have a long history here in Wisconsin of insuring our residents. It's a proud history, and so we've always ranked in the top. I'm not sure if we're still number 2, but we certainly are up there, and our uninsured rate I think is just under 10%.
Okay. Any PS on that, Donna, or no?
So it depends on what survey you're using.
Okay,
certainly.
thank you.
But yeah, I'll leave it there.
All right. Let's talk about, though we were at 205,118. Let's look at graphics showing the drop. Let's just focus on the last 2 years and the number of Wisconsin residents. In 2017, 242,863, and in 2019, 205,118. So 37,745 were no longer covered who were in 2017. That's a drop of 15.5%. But I also, when I just looked it up, the Kaiser Foundation, our drop of 15.5% is much more, 2.5 times the national drop, and I've got to go slowly because of all these numbers, of a national drop from 2017 to 2019 of 6.5%. Why is our drop in the number of ACA enrollees 2.5 times the national drop over 2 years? Anybody?
Well, I mean, I think there are a few factors. I think a shortened open enrollment period has impacted here in Wisconsin as well as across the nation people's ability to sign up. There's just a shorter window for people to do what they need to do. I also think that we've seen in more recent years messaging and interest in the ACA at the federal level waning, and that has impacted the conversation at the state level, and I think that's why it's really important that we here in the Evers administration, with our community partners who've been working on this for the first 6 open enrollment periods, we are happy to join them this year to really raise the profile of access to health insurance through the marketplace, the fact that it's that there are affordable options, the fact that there are navigators to help you through the process, and there are ways to have access through calling 211 to get to a navigator, through healthcare.gov, et cetera, so that folks really understand their options, and the fact that the Affordable Care Act and the choices on the marketplace provide really affordable, high-quality coverage for them.
Donna, as a researcher, how concerned are you about the 15.5% drop over 2 years?
So
Troubling?
We don't like to see a drop, of course, if people are just dropping and not getting other coverage. If people are getting other coverage, ultimately the goal is for people to be insured and get the coverage they need and have it be high-quality insurance. With regard to why did Wisconsin's rate differ and look larger than that national number that you saw in Kaiser, I think the national number is an aggregate number of all states.
Yes.
So that includes states that were very bullish on the ACA and the fewer states in which Wisconsin is one that were not for the past several years bullish at all, and they were bearish on the ACA. And so if you were to separate out those numbers and look at Wisconsin along with the handful of other states that were not aggressive and were somewhat disinterested in the ACA with regard to promoting enrollment or promoting participation in the marketplace, and also the not participating in the ACA Medicaid expansion, you would see that Wisconsin looks a lot more like that handful of other states. But the national aggregate figure looks better because most of the states around the country were bullish on the ACA, and so the figure gets pulled up for that reason.
Well, I know it's maybe a little unfair, but is there a Democratic profile of the 205,000 who enrolled this year in terms of male, female, and age and income, or is that?
Yeah.
Is there a profile, Donna? What is it?
It's roughly equal male, female, slightly more women than men, but roughly equal. In terms of age, we look mostly at between the ages of 18 and 64.
Yes.
And if you broke that up into 10-year categories, 18. Well, I don't want to get too granular here, but in each 10-year category, there's about 15% of the enrollees. But then when you get to the 55 to 64 age range, yes, we're looking at about 35% of the enrollees. So it definitely skews toward that older group of people who are nearing retirement but not eligible yet for Medicare. So quite a few of the older people relative to the young. So again, 35% to 38% in that group, 55 to 64. The rest of them, 18 to 55, with approximately 15% in each of those 10-year intervals.
So the biggest beneficiary of ACA in Wisconsin is this age bracket that you just outlined, the ones that are not yet eligible for Medicare?
Well, everybody.
Have I heard it right?
If you're looking at the age groups, that's how it skews. But each group has its own degree of benefit. Certainly, young invincibles have a benefit not only by participating in the ACA, but many of them are now covered on their parents' policies until they're age 26.
Okay. I'm really intrigued by the county-by-county drop-offs. And thank you for those figures from your office. Yeah. Let's look at a chart in just 4 counties. Milwaukee County, over the 2-year window, 2017 to 2019, 26% drop, 10,023 people. Menominee County, 38% drop. And we just picked Washburn County, where none of Wisconsin's 72 counties had an increase over these 2-year windows. And then we looked at Dane since it's the largest. Why is there such regional disparities? But do you want to just start on Milwaukee County? Does that critically hurt the health care in Milwaukee County generally when 10,023 people are no longer on the ACA over a 2-year period? Your thoughts?
Well, I mean, I think as Donna has articulated, I think we believe any loss in coverage is assuming that they didn't go somewhere else, is not what we're looking for, and it certainly is why we're here encouraging people to sign up. I think one of the things that we have done this open enrollment period that we hope stems the tide and even some of this out is invest in some additional navigator resources. So we have put an additional almost 9 FTE into navigators and certified application counselors around the state to try to help reduce the declines, stop the declines, start us going in the other direction. But those in-person resources that folks can use to really help them navigate this system, we have found here and nationally are critical to successful enrollments. And so I think we are very hopeful that these additional investments in our infrastructure to help people sign up will really help us see improvements in a variety of counties around the state.
Do either of you have any estimates, or have you seen any estimates? The number of Wisconsin residents who are eligible to enroll in ACA yet do not. Do you think most people who are eligible for ACA enroll in Wisconsin, Donna? Or
so, we don't. We don't have that exact
right.
estimate.
There is a very undefined universe out there. How many are eligible?
Because there's income eligibility, but then there's a number of other factors about whether they have access to employer-sponsored insurance and the like. So we can talk about income eligibility more frequently. We look at how many people are income eligible to enroll in Medicaid that we have not yet gotten enrolled, and the new navigator and outreach capacity that Secretary Palm and Governor Evers' administration is investing in is also very focused on doing that, trying to get people enrolled in Medicaid that are eligible but have not yet managed to find their way to that enrollment.
Okay.
So,
okay.
Yeah.
Donna, you want to talk about some of these county changes? Is there anything that concerns you? And by way of context, the 205,000 that were eligible this year, largely 1/3 of them were in only 4 counties: Milwaukee, and Dane, and Waukesha, and Brown. What about these county-by-county numbers? That any takeaways? Any trends that you see?
So the variation in what happens in the counties really depends on several things. The outreach and enrollment capacity is one factor. Having said that, I want to recognize that a lot of the enrollment happens through agents and brokers, through health systems, through online on healthcare.gov and the like. So the actual navigators on the ground, very important. The public messaging is very important, but it takes a lot of different kinds of capacity to get people enrolled. The other piece of it is the availability of health plans, what the pricing is that's going on, and the pricing in our state is in 9 different regions, so the prices really vary. And over the last couple of years, we saw a lot of volatility in the price of the health plans and what people might consider the affordability of the health plans. Now it's starting to stabilize, and so when you see this variation county by county, yes, what you're really seeing is that there was a lot of volatility in terms of health plans coming and going in the marketplace and what the pricing was of those health plans, and that created a fair amount of instability in terms of signups and people getting reconnected to coverage when they had changes in their health plan and the premium that they had to pay.
But your message is, with the deadline approaching, more Wisconsin residents should take a serious look at whether they're eligible, and if they think they might be, what next step should they take?
Well, and I think, Steve, that's one of the important things about the opportunity to work with a navigator is
How do I find a navigator?
So if you call 211, we have expanded capacity across the state for 211 to take calls and connect you with an in-person navigator locally. And you can talk to them. You can make an appointment, talk to that navigator in person or over the phone, and they can help you start to finish through that process. But they not only, as Donna's mentioned, know the Affordable Care Act and the options on the marketplace, but they also know and understand Badger Care and can help you enroll there. And so they have a broad expertise in health insurance, and so it's kind of a one-stop shop to make sure you're connected to whatever health care you are eligible for. But they know the tricks of the trade. They've been doing this for a while. They understand how the subsidies work, how that applies to which plan you're picking, and help you pick one that really does get you the best bang for your buck, the best option for your budget and for your family.
Does the 211 system exist statewide?
Yes.
If I live in Barron County, Taylor County, I can dial
Yes.
211?
That's part of the capacity that we expanded with some of our investments, was so that 211 call could be made anywhere in the state, and that they would have the capacity to connect you to a navigator.
Okay.
And I want to make sure people are aware,
Thank you.
just apart from the comments I just made about the volatility in the market, I want to emphasize that things have really stabilized now. So we have a lot of plans. We have multiple plans in every county, and the prices have come down in the last year. And so there really is a good amount of affordability, and encourage people to take a look, because there are even zero premium plans for people in certain income groups, and people should really take a look at Connected with Navigators to see about their eligibility and potential eligibility for Medicaid.
I want to come back to a point you just made, that there are multiple providers in every one of Wisconsin's 72 counties, because I've read some national stories about Wyoming and where places there's only one provider. So we're not like that. We're not that bad. Correct?
No, I mean we've always been a state with many insurance carriers, and now this year more carriers have broadened their service areas, so there's a lot of coverage, a good strong coverage around our state.
Can we talk just for a minute about the changes in incomes in terms of who's buying this?
Yeah.
This is our third graphic provided by your office, Donna. Thank you. Boy, there's a lot of numbers here. Can you boil it down for somebody like me what's important here?
The takeaway from this, and you're right, it is confusing, is when we talked earlier about over the last few years, there's been a decline both in Wisconsin and nationally in overall health plan selections during the open enrollment period, and that's due to a number of factors. But when we look at break down the overall numbers about where the decline has been occurring, it's been occurring at the lowest income levels. So
and
the people closest to, I'm sorry, go ahead.
Where are they on the chart? Those with the
so
lowest
that
income
if you
level?
look at the line
bottom?
at the top, no, actually it's a little. Chart is a little confusing in how it's laid out. But if you look at the line at the top,
yes.
that says 100 to 150% FPL. That means federal poverty level.
Right.
So those are the people that are closest to the federal poverty level. That's the lowest income group eligible to participate in the ACA marketplace.
These are folks making $7, $8, $9 an hour.
Thank you.
Yeah. So those are the people that most of whom would, in other states, would be covered under Medicaid expansion. In Medicaid expansion, under the ACA goes 100 to 138% FPL. Okay. But in Wisconsin, we have them in the marketplace. And those are the people that you see here had the most substantial decline over these last several years in participation in the marketplace. From
these would be the top two lines?
The top two lines.
Thank
so
you.
The 100 to 150% and 150% to 200%. If you look at the other lines between 200% and 300%, over 300% FPL, all of those income categories either maintained or increased their participation in the ACA marketplace over these years. So when people talk about declines in participation in the marketplace, we're actually seeing that the working class population is still finding a lot of value in participation in the marketplace, but the near poor are the ones that are struggling to maintain their participation. And that's where there's that debate about should they really be covered by a Medicaid expansion. What can we find that's affordable and sustainable for them in the marketplace?
Let me step back and ask a question about the 205,000 that enrolled in this year. If they didn't have the ACA option, what would their choices be? Going without health care or what?
Yeah, I mean, I think maybe they've moved employment, and that job now offers coverage that they didn't have before in their previous job. But I think that was sort of the point of the Affordable Care Act, was to fill a gap for folks who didn't have access to coverage otherwise, either through employer, through Medicare, through Medicaid, Badger Care, and who needed protections from plans that weren't really giving them anything for their money. And so the Affordable Care Act was designed to fill that gap. And so while we hope that folks are moving on to other plans, other places that they're getting coverage, it certainly is possible that many of them are going without health insurance.
So before the ACA, we look at 2013, which is pre-ACA, and today in terms of insurance coverage in our state. And the federal statistics show that pre-ACA we had about 550,000 uninsured people in our state, and now we have about 300,000 uninsured people in our state. So some of that, because that's a larger number than the 200,000, some of that the economy has improved, right? Yes. So it's not person per person, but we've had about a 200,000. Clearly we've picked up people, a large number of people in insurance coverage because of the ACA, as well as other factors. The overall rate of uninsurance in our state between 2013 and today, and the most recent data available, which is 2018, we've gone from 9.3% to 5.4% today. So a substantial drop in the uninsured.
Well, ACA passed in 2010. Yeah. It took a few years to kick in.
Right.
And then the attacks on it. It was, maybe it's unfair, it was kind of a three-pointed stool. You had the mandatory, you will have coverage. And if you don't have coverage, you pay a penalty. Those have been knocked out. How has the ACA in Wisconsin changed now that there's no longer a mandatory thou shalt have, and if you don't, you pay a penalty? Has that harmed the ACA in Wisconsin?
So I think what you see here and across the country is people wanted health insurance. They were looking for something to fill that gap between employer and publicly sponsored healthcare in a way that was affordable and high quality. And so the increases that you've seen in the Affordable Care Act, while we have seen some declines in recent years for the variety of factors we've already talked about, I think the bottom line remains that people want access to healthcare. They want access to insurance that they can trust and that is affordable for them and for their families. And so I think we continue to push against the narrative that the ACA is on the decline, because what you can see in all of the numbers is that there's still strong participation. And what we really need to do is make it affordable and more affordable, expand Medicaid for those who really are struggling, as you saw in the top lines of that graph, to maintain their coverage so that we are filling that gap and everyone has access to insurance they can afford.
As healthcare professionals, are you really afraid of this federal lawsuit? Now in the district court, I think it's part of the Southern District that covers the states of Louisiana, where the initial judge ruled that the ACA is invalid. How concerned are you about that? And if it goes to the Supreme Court and the ACA is thrown out, what happens in Wisconsin?
So I think I'm really glad that you asked this question, because it's important for people to know. I think it is part of the static in the system. People are unsure about whether it's still going to be there or not. And what we have said and what you've heard out of the U.S. Department of Health and Human Services, Secretary Azar, is very clearly that plans are set for 2020. That coverage is here to stay. People should go on healthcare.gov. They should call 211. They should get connected to a plan that works for them, because 2020 is set. And it will take a while for that case to wind its way to completion, and so people should get enrolled. So
bank on the ACA for 2020. In light of what you just said, a press release from Senator Tammy Baldwin warns about, this is her term, brokers selling junk insurance plans. So if someone who's up against the deadline of December 15th, maybe searching around, how real is the threat that they're going to be sold what the senator called a junk insurance plan?
Again, a really important PSA. I'm glad you brought this up, because junk plans are a concern. If you go to healthcare.gov, if you get connected with a legitimate navigator through 211, they're not going to sell you a junk plan. on healthcare.gov, those plans are not allowed to advertise, and navigators know the difference. If you just Google health insurance, who knows what you are going to get? So make sure that you're working with a legitimate agent, broker, 211 Navigator, and healthcare.gov, and you'll be protected from those junk plans. But it's true, they still exist. They're still floating around there. And there are folks who are affirmatively trying to get people to enroll, to actually propagate scams on folks. And so people should be very, very cautious.
Senator Baldwin's press release says these junk plans, her term, do not include coverage for prescription drugs, emergency room visits, and maternity care. So people, even though they may be low cost, the premiums may be appealing, the danger is you're not going to be covered with these junk insurance plans.
Yeah. And all the other consumer protections that are part of the Affordable Care Act, pre-existing conditions, lifetime limits, the things that we all have grown to trust about health insurance on the marketplace and through our employers don't exist in these junk plans. And so if people are calling you, soliciting you, you should just be very careful. 211 will get you to a certified navigator who knows the difference and can help you navigate the system.
Okay, a couple more questions because we're getting low on time. First question, how would the picture of ACA change if Governor Evers' plan to expand Medicaid with federal dollars did become law, even though it's been blocked? If it became law, how would all this change, Secretary?
So I think, Donna's chart really highlights that affordability issue. I think, the debate about this throughout the budget process was very much about encouraging folks to use the marketplace as their doorway into insurance. And we think that is absolutely a place that people should look, should shop. They may be able to find $0 premiums, as Donna has said. But what we see from the declines in insurance rates, in marketplace rates in Wisconsin, is that it is that lowest income bracket that is struggling the most to afford it. And a Medicaid expansion would address that issue because Badger Care is a high quality, very affordable option for those up to 100% of poverty and hopefully those up to 138% of poverty. So we will continue to prioritize Medicaid expansion as a way to make sure that folks can make ends meet, that they can afford the other parts of their budget beyond just health care, and that we're supporting folks across the board.
But meanwhile, meet the deadline for the December 5th deadline for the ACA. Excuse me,
Yes.
your thoughts on any potential change if we did expand Medicaid?
Well, I do want to know, I think there's two messages here that seem at odds but are actually the same. When we're thinking about this very low-income group that right now are in the marketplace but could be Medicaid eligible, on the one hand, we do want them to look now at the marketplace, and because there are plans that they can very low with very low premium, and they can enroll in and get a basic degree of coverage. However, it is very limited coverage when you're getting a $0 premium plan, and it's not going to cover without various cost sharing. It's not going to cover many things that someone who's living in near poverty may need that a Medicaid plan would cover. And particularly right now when we're dealing with a lot of concerns around behavioral health, substance use disorder, a lot of times commercial plans aren't going to provide the kinds of things that they would be able to get if they had Medicaid plan, and it's the cost sharing elements there that are going to be challenging for this very, very low income population. So yes, we want this very low income population to get what is available to them today, and there is something available to them, but it's not going to be necessarily the kind of coverage that is going to meet the needs of this population.
Well, you were just talking about specific services. Just generally, has the ACA helped approach mental health issues? We're talking in a week when there's been school shootings and school threats. Has the ACA been helped focus on mental health issues, Secretary?
Well, I think mental health parity was designed to apply requirements to health insurance that again provided some parity between medical and mental health, behavioral health. I think there's we have a long way to go, and we've talked about this before as well, that the integration of healthcare to include substance abuse and mental health services is a critical sort of next step from my perspective in how we evolve and how we improve healthcare across the board. I think some plans do a good job of it, others less so, but it is a place where we as a state could really take a leadership role in integrating access to behavioral health services into the basic and fundamental access that we get when we get health insurance.
Final question to both of you. Is it helpful as we try to sort through the healthcare, the huge issues, to hear presidential candidates talk about Medicare for all? Is that helpful as a backdrop, or is it just confusing as people have to meet a December 15 deadline? Just curious.
So I think it's great that people are talking about improving access to care, right? It is what we intended with the Affordable Care Act. It is some of the progress we have made. Obviously, more to make as we continue to push to reduce the uninsured rate even further. I think from my perspective, the Affordable Care Act was about building on the strengths of the health insurance system we had, a very uniquely American healthcare system, and those are the places where we should continue to dig in, to put our shoulder to the wheel and to make progress. These affordability issues, which are the things I hear about when I travel around the state of Wisconsin, is whether it's prescription drugs or co-pays or premiums, it is the affordability issues where I think we really should be focusing our time and effort, and but more broadly, talking about access to care is a really important piece of this. But right, those are plans for post-election.
Yes.
And so right now, people should meet the deadline, call 211, go to healthcare.gov, talk to a navigator, get themselves in a position to sign up for a plan that meets their needs and their family's needs.
And any final statement on the December 15 deadline, Donna?
I echo everything that you heard from the Secretary on that. I endorse.
I appreciate that. Very important issue. I want to thank Andrea, Secretary of the Wisconsin Department of Health Services, and Donna Friedsam, who's a researcher, Health Policy Programs Director for the UW-Madison Institute on Research on Poverty. Thanks so much. Very important issue.
Thank you.
Thanks.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol. WisconsinEye would not exist without generous donors like you. Please visit wisci.org to make a donation today.